Hello, everyone. My name is Preeti Raghavan, and I am grateful to the Foundation of Physical Medicine and Rehabilitation for selecting my proposal for the Allergan Foundation Neurologic Rehabilitation Award. The title of the proposal is Feasibility of a Kinect-based Citizen Science Tele-Rehabilitation Platform. And the proposal was designed to answer the question, how can we motivate individuals with stroke to participate in rehabilitation at home? As you can imagine, this is particularly critical during the time of the pandemic when many patients with stroke are stuck at home, unable to receive services. This proposal was created in collaboration with Dr. Maurizio Porfiri from the NYU Tandon School of Engineering. He created a citizen science platform to motivate individuals. Citizen science projects enable members of the public to take part in scientific research to address real-world problems. In this case, he designed a platform to identify environmental hazards along a canal in New York City. But the question is, how can we facilitate the interaction of a patient with stroke with the platform? That is not easy because patients can't really interact so easily with a mouse, a typical mouse. So I worked with graduate student Ronnie Barak Ventura to design a dowel that patients can hold with both hands and perform specific movements to interact with the citizen science platform. Now, when holding the dowel, the intact limb can help move the affected shoulder, elbow, and wrist joints to interact with the computer. So, for example, if the individual needs to make a selection, they need to flex and extend their elbow. In order to move the cursor up and down, they need to flex and extend their shoulder. In order to move the cursor left and right, they need to abduct and adduct the shoulder. And they can use forearm rotation and wrist flexion and extension to pan the image left and right or up and down. By performing these movements in this manner, we can also quantify the movements at the various upper limb joints and examine the quality of the movements as shown here. The aims of this particular study are to evaluate the usability of the platform with stroke patients, specifically to examine the cognitive and physical capacity of patients to use the platform independently without the aid of another person. To assess the efficacy of citizen science in motivating patients to perform exercises, and to test whether the platform can reliably capture movements of the shoulder, elbow, and wrist joints. This work will be performed at the Motor Recovery Research Laboratory at Johns Hopkins University, and it will support research personnel who will collect and analyze the data. Thank you once again, Foundation of PM&R, for allowing us to do this work.